Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Colorectal cancer is very common in the United States. In fact, it's the second most common form of cancer. And what's interesting about it, though, is that the vast majority of cases are preventable through screening. Only about 50% of people actually come in to have their colonoscopies done. Now, colonoscopy is actually a relatively straightforward examination that a lot of people fear, but in the end, when they look back, they realize that it really wasn't very much of a big deal at all. Most patients say that the hardest part of a colonoscopy is the prep itself, and that's done the day before. The day of the procedure tends to be a bit more of a blur. You present to the endoscopy suite, you're prepared by the expert nurses, and then once you come into the endoscopy room itself, you're administered some sedation that tends to put you to sleep. And the next question, typically when the exam has been finished, is when are we going to start? There are about 150,000 new cases of colorectal cancer diagnosed each year in the United States. It's a big number. And there are about 50,000 deaths. We think that probably somewhere between 80 to 90% of those can be prevented merely through screening. And so that means coming in at age 50 for a colonoscopy, regardless of if you're having symptoms or not, or at an earlier age, age 40, if you have a family history of colorectal cancer or colorectal polyps. So during March, at least, if you're going to make one decision with regards to your health, I would recommend that you contact your primary care doctor, let them know that either you're having some symptoms, whether that be some blood in your stools or changes in your bowel habits, or just that you're age 50 and you haven't had a colonoscopy. They can refer you to a gastroenterology specialist who can get you in for a colonoscopy, and then we can take it from there.
For more health news, stay tuned to Health Watch, or you can check on chartertv3.com and click on the Health Watch page. I'm Caitlin Tivnan. Stay healthy.